Now, 5 years after the coronavirus pandemic, there are concerns simmering over a new infection. It is the HMPV, or the human metapneumovirus. An outbreak of the infection in northern China has prompted some alarm, but experts say that HMPV is not COVID. In recent weeks, videos on social media have shown hospitals in northern China overrun with masked people and arising cases of respiratory illnesses. Beijing has acknowledged an uptick in cases of the flu-like HMPV, especially among children, that has called it a seasonal spike. So far, apart from China, 8 cases have been reported in India. According to reports, Malaysia, Kazakhstan, the United Kingdom and the United States have also reported a rise in HMPV cases in recent months. In India, the first 2 cases of the HMPV infection were reported in Bengaluru, in the state of Karnataka, both among children with no travel history. The 3rd case was reported from the western state of Gujarat. The 4th and 5th were reported in the southern state of Tamil Nadu. Following which, 2 more tested positive for the infection in Maharashtra's Nagpur and 1 in Mumbai. Now, it is pertinent to note that although these countries are battling an HMPV outbreak, the discovery of the virus is not new. It was first identified in the year 2001 by Dutch scholars. The Chinese Center for Disease Control and Prevention says that the virus existed for at least 60 years. Experts say it is a common virus that affects the respiratory system. But is it dangerous? What are the symptoms? And when should you seek medical care? We'll answer all of these important questions for you. First, the symptoms. Those infected with the HMPV could suffer from a cold, wheezing, high fever, sore throat, nasal congestion, dehydration, and shortness of breath or difficulty in breathing. In severe cases, the HMPV infection could cause bronchitis and pneumonia. The infection poses a significant risk to the vulnerable groups, including children, the elderly, pregnant women, and those with chronic health concerns, and those with weakened immune systems. So how long does the infection last? The symptoms of the disease are typically appearing in 3 to 10 days after infection. The United States CDC says that the estimated incubation period is 3 to 6 days. The duration of the illness depends on the severity of the infection, but is similar to other respiratory infections caused by viruses. If you have been in contact with someone diagnosed with HMPV during an outbreak, you must get tested. You should also see a doctor if you are experiencing severe respiratory symptoms, such as difficulty in breathing or persistent fever, especially if you belong to a high-risk group. Is the infection contagious? How does HMPV spread? Well, like other COVID, the HMPV is also mainly transmitted through droplets or aerosols produced by coughing and sneezing. It can also spread through close contact with an infected person or by touching contaminated objects or surfaces and then touching the mouth, nose, or eyes. Preventing the spread of HMPV would require you to bring in basic lifestyle and hygiene changes, most of which we adopted during the coronavirus pandemic. Wear a mask when going to crowded places and avoid poorly ventilated places. Now, this may bring back memories of the pandemic days, but this is still essential. You must also wash your hands frequently with soap and water for at least 20 seconds and avoid touching your eyes, nose, or mouth with unwashed hands. You must avoid close contact with people who are sick. Those with cold-like symptoms should cover their mouth and nose when coughing and sneezing. Now, scientific disinfection can also effectively reduce the chances of HMPV infection. For now, there is no vaccine to prevent one from catching the HMPV infection. There is no specific antiviral therapy either. Now, one question that is looming over everyone's mind is, are we going back to the pandemic? Will HMPV cause another lockdown? Can it cause an epidemic? HMPV infection can cause outbreaks, but medical experts and governments say there is no need to worry. In India, the government has reassured people that there is no cause for alarm. However, it has asked state governments and medical teams to step up surveillance and for people to remain vigilant. To address more concerns and to allay fears and bust myths that are doing the rounds on social media, we are being joined by Dr. Vivek Nanagia, who is an internationally renowned interventional pulmonologist. He is the Vice Chairman and the head of the Institute of Respiratory Critical Care at Max Healthcare. Welcome to Firstpost, Doctor.
Thank you.
Now, Doctor, what is HMPV and how does it differ from other respiratory viruses like coronavirus in terms of symptoms and transmission?
So HMPV is the virus which we've known about since 2001, as you rightly said, human metapneumovirus. And we see such patients, cases of this viral infection every year, practically around this time of the year, during winters and extends up till the springs. So as far as the symptoms are concerned, there is no difference between the symptoms of those caused by HMPV or by corona or any other respiratory virus. They usually are the same: cold, cough, sore throat, fever, running nose. And if it goes into the lungs, it would start causing breathlessness, chest pain, and even blood in the sputum sometimes. So clinically, based on symptoms, it isn't possible to differentiate between the different viruses, whether this is COVID or influenza or respiratory syncytial virus, which also becomes quite common at this time of the year, or it is HMPV. The symptomatology is just the same.
Right. And what basic precautions can individuals and families take to protect themselves from HMPV, especially during the peak respiratory virus seasons?
So again, the same standard precaution that you would follow for COVID, that you would follow for influenza, you would also need to follow for this HMPV virus. So the most important thing that I tell all my patients is that one is that don't need to panic. You just need to be vigilant and cautious, but not to be in a state of panic. Whenever you develop cough, cold, fever, best is to isolate yourself for the first 3 to 4 days. Stay indoors. Do not interact with other people so that you're not transmitting it to others. Next thing is that only if your symptoms continue to worsen, the fever persists, breathlessness sets in, oxygen levels drop down, that is when you should be contacting your doctor, not until then. Till then, only take things like paracetamol, keep yourself well hydrated, maybe vitamin C you could take, and just good rest is what is needed.
Right.
But
and Doctor, is there... Carry on, sorry.
Yeah. So the other things that you can do is, follow the cough etiquette. That whenever you're coughing, you should be coughing either into a tissue or into a handkerchief or into the upper part of your arm, so that the secretion is not spread all over. And then the usual standard precautions of maintaining distance, avoiding to go to overcrowded places, strict hand hygiene to be followed, and move away from the concept of shaking hands to say hello. I think it's time to go back to our usual Indian way of greeting, that is the namaste. So I think those are the simple precautions that you need to follow, and wear a mask. When you talk of mask, then it has to be an N95 mask, and it can't be anything less than that.
Right. And is there any ongoing research or development for an HMPV vaccine? And how soon might we see it becoming available to the public?
So science is always ever evolving, as we know that. So there are vaccines which are in the stage of development. They have completed the experimental stage, the animal stages, and are currently in human trials. There's an inactivated vaccine, there's a live attenuated vaccine, which is under trial, which has shown safety and efficacy. But it's difficult to predict when will they be out in the market for commercial use or for public use. But definitely the research is going on. And I think now with this HMPV scare, the vaccines may just be expedited and we may just get them earlier than late.
Right. Doctor, thank you very much for being with us on Spotlight. We appreciate your expertise and advice.
Thank you.
From breaking news to the day's biggest controversies, shedding light on the world's top headlines, detailed analysis on the stories that matter the most to you. Catch it all on Spotlight at 6 p.m. India time and 12:30 GMT, only on Firstpost.